Valencia here in Spain. So as a Spaniard, I'd like to first welcome to Spain. I hope you're having a nice conference, and thank you for coming. I'll be speaking a little bit on the chromatic aberration with the ischemia family of lenses. So first of all, I'd like to show that my disclosures are my PhD advisor, clinical studies, and that's the only one about disclosure. So chromatic aberration is a property of materials that defines that refractive behavior of the material is different for different wavelengths. In most materials, this means that shorter wavelengths will focus before longer wavelengths, and within the eye, what that means is that some images will focus different distances from the retina. So it's normal that the human eye, as you know, has chromatic aberration. That depends on a parameter that's called the Abbe number that relates the level of constriction or the difference between the different pulsing of the different wavelengths. Therefore, the higher the Abbe number, the lower the chromatic aberration. Now we know that for the human lens, the Abbe number is around 46, 47. So that would be mean in terms of any material trying to substitute the human lens, which is a similar value of chromatic aberration. It means that we're moving within a well-tolerated range of chromatic aberration within the eye. Now, we have measured different studies throughout the years have measured the chromatic aberration of the human eye, but we have quite a lot of discrepancies in the actual numbers of chromatic aberration we get in the eye. That will depend on different factors, such as whether it's an objective measure or a subjective measure, because there is an adaptation, neural adaptation to chromatic aberration, but also depends on the actual wavelengths that are being used for study, for measuring that wavelength aberrations. So in this little talk we're going to have now, we're going to be exploring what are the values of chromatic aberration with a spinning family of lenses to try to determine whether it has a benefit or not for the actual patient. Now, we know that from an optical perspective, the human eye is far from perfect, but we also know that those imperfections sometimes turn out to be quite useful tools for the vision system. And in that sense, chromatic aberration is no different. Different studies have shown that chromatic aberration actually has some beneficial character for eyes. For instance, we do know that increases depth of field, the fact that different images with different wavelengths are at different distances basically means that for every vergence distance, there's always an image that is a bit closer to the retina, and that can be used in a positive way by the human eye. However, that has the negative impact that decreases the retinal image contrast, which from an optical perspective is something that we wouldn't want the image, and in fact is something that, for instance, with photography or imaging, it's always corrected. As an example, we can see this images here. So you can see on the left hand side from that image, you can see the image towards the edge. You see the little colored fringes that's showing the shift between the images in from red, blue, and green, whereas it is corrected on the right hand side. So you can see very easily what the impact of correcting chromatic aberration has in an actual image. That translated into a black and white pattern as we normally use for resolution in clinical terms. We can see that there is an effect as well. Here we see the polychromatic chromatic aberration, and here we see the aberration corrected. So it's easy to understand that from an optical perspective, correcting chromatic aberration is a plus in terms of visual performance. Now, we also know that in a fully functioning eye, we know that there is a role in chromatic aberrations. For instance, providing some odd cues for accommodation response. We still don't know how that works. Still ongoing research, but it seems that there is a role for the microfluctuations of the eye and the actual chromatic aberration to guide the system to whether it has to increase focus or decrease focus for focusing on the image. And also some research has shown that possibly there is a role in chromatic aberration in guiding the eye growth in the early youth, childhood. Now, that's for a fully functioning eye, but here we're talking about IOL implantation, which in most cases means it's an HI in which there's no accommodation and the eye is fully grown. So let's say, thinking about it from the beginning would be a benefit in correcting that aberration. So now we'll see what we've done to try to determine in that case what happens with the skin family of lenses. One thing that we know is that normally we have longitudinal, as I said, for shorter wavelengths, we focus before longer wavelengths. What we do know is also that diffractive chromatic aberration, diffractively generated chromatic aberration, is reversed. So we know in this quite extensive research showing that chromatic aberration in diffractive lenses is kind of compensated by the diffraction pattern. So we want to explore that with the skin lenses. So for that we did measure monofocal, trifocal, and EDOF IOL essential skin family. All of them have the same base B-spheric design, diffractive with 15 grains diffractive pattern. And we explored this wavelength from 48 nanometers to 650 nanometers for the red color. For the monolight, you use the monolight type 2, which is with an ISO approved aberrated cornea. That means it has an induced spherical aberration of 0.295 microns. That's to mimic what research has shown to be most of the corneas across the population, most of the healthy corneas across the population. As you know, the Skilio family of lenses has a negative spherical aberration of minus 0.27 micron. That should compensate largely most of the spherical aberration, which is the initial starting point advantage in that sense. And we did 3 repeated measures for each of the lenses, well centered, and I'll show you the results for the 3 lenses. For that we used the PMTF, which is a very widely used optical bench device for measuring performance of IOLs. So this was what we obtained for the monofocal IOLs. This is a through focus MTF. So for the 50 light pairs per millimeter. So from this one, once we remove the chromatic aberration that has the system itself and the actual artificial cornea that we use in the system, we obtain a chromatic aberration of 0.35, which is pretty close to what the little research that has been done on chromatic aberration of the lens, isolated with all the complexity that involves, because as you know, the lens is a very complex refractive system. It's quite close to the value obtained in research. But now if we look at the premium designs of these lenses, the through focus for each of the wavelengths, we can see this. We see the MTF through focus that is centered on the green, as we normally do. So we can see the shift between green, blue, and red. And we can see that the distance for the trifocal design is optimized for the red, slightly decreased for the green and blue, and that shifts over for the near vision as well. And the opposite happens with the EDOF design. Now in the trifocal we can see more clearly this intermediate and near different foci. We can see that the drop in MTF from the intermediate and near is not huge, and that comes from the various technology applied to the design of the trifocal IOL, which means that the diffractive pattern they use create a depth of focus-like shape within the MTF curve from the intermediate to the near. So there's barely a drop in the MTF response to that distance, and we can see that for the near one. Now, for the EDOF design, that residual, that chromatic aberration actually plays a positive role because it helps create EDOF, helps create additionally plus in the extended range of focus. Now, to have a closer look to what happens, so I'm going to show you, instead of showing the MTF for 50 cycles per degree, I'm going to show it as the area under the curve from 0 to 50 on each of the points, divergence points, so you can see more clearly the change in the peaks for the different distances. So here you see we have the spherical aberration for distance, which is very similar to what we found with the monofocal one, as we expected, but now it's more clear to see the reduction in that gap between the different wavelengths for the intermediate and for the near. You can actually see a reduction in the chromatic aberration of around 1/3 for the intermediate compared to distance, and about half the chromatic aberrations we got from distance. So that means that from already low chromatic aberration from baseline, because of the high the number of the Ascilio material, that chromatic aberration is actually decreased because of the diffractive pattern in the trifocal lens to actually half of that value for near distance. That has the positive effect that of a much greater correction of that chromatic aberration effect in near distance, which is where you would like to have the sharpest image for the patient. So that would be another benefit. So as a takeaway message, we have a baseline high RB number, which means a baseline low chromatic aberration for Ascilio family of lenses. That for trifocal design gets even decreased further for intermediate and near distances to almost half of that value for near, which is a very positive enhancement for patients because obviously we want to have the sharpest, the crispest image when you're looking at something actually doing new work activities. Then in the set with EDOF, the actual chromatic aberration that the lens has, this helps create that extended range of focus and distance. So thank you very much for your attention and open questions.